Hi, I'm Matthew Huffman, Public Affairs Director at the Missouri Coalition Against Domestic and Sexual Violence. Joining me in our Innovation Lab today, we have Joan Masters, Senior Coordinator at Partners in Prevention, and Sarah Erhard-Reed, Deputy Chief of the Office on Women's Health in the Department of Health and Senior Services. Thanks for coming by today.
Thank you. Thanks.
Yeah. So I'm really excited to have y'all here so that we can talk about some of our collaborative projects we've been working on, and then also give some recommendations on how those can really impact and influence some of the prevention efforts happening around our state. So here at MCA-DSV, we work really hard to implement comprehensive prevention, and we do that through our public policy implementation by practicing strategic partnership and collaboration, very similar to the work that we all do together, and then also by promoting healthy sexuality throughout the lifespan. And I know that's something that we talk about quite a bit in our roles, but really recognizing that many college-age students are coming to campus with little to no prior education on consent and healthy sexuality. And so I think it's really important that we keep that in the forefront of all of our prevention efforts. And something else that we've worked on the last couple of years, MCA-DSV and Partners in Prevention have collaborated on a research project to really look at true prevalence rates of sexual violence happening on our college campuses. So comparing our member service statistics alongside the Missouri Assessment of College Health Behaviors and then specific campus reports from their Clery reports to be able to look at how are students experiencing sexual violence to give us a more accurate reflection of prevalence. And then another part of that research was to look at barriers to collaboration between community-based domestic and sexual violence programs and then campuses, and really trying to identify the strengths and the needs inside of that so that we could help our campuses and our community programs really kind of bolster their efforts, as well as provide complementary and consistent messages both on campus and off campus around prevention, around support services, and just really being able to help provide better examples of collaboration. So Joan, can you tell us a little more about Partners in Prevention and then some of the work that y'all have been doing around the intersections of alcohol and sexual violence?
Sure. So Partners in Prevention is the coalition of 21 universities in the state. We receive most of our funding from the Department of Mental Health, but have supplementary projects to address a variety of health behavior issues that our college students in Missouri are experiencing. What we found is that the benefit of a statewide coalition is that our campuses lack some of those vital resources for both training and understanding the issues at hand that are the most common behavioral health issues for our students. And so our coalition helps to provide that training and support for our campuses, whether it be their health providers or those who work directly with students as counselors, or our law enforcement or conduct officers on campus. And we've been in existence for about 18 years. We predominantly started to work on issues related to binge drinking and alcohol and other drugs. But what we were finding certainly is that college students are experiencing a wide variety of behavioral health issues or consequences of others' behavior. And sexual violence is something that within the past 8 or 9 years we've started to really look deeper into, as we know our students are experiencing sexual violence or our students are perpetrating sexual violence on others. And across the state, we want to give our campuses the best information that they can have about evidence-based strategies and how to collaborate to address those issues. One of the ways we've done that is to have the MOCB, which you referenced before, the Missouri Assessment of College Health Behaviors, and really look deeper into who on campus is experiencing sexual violence at higher rates, who of what subpopulations are at the most highest risk, and where they're receiving resources if they do experience sexual violence, or where they're not going to receive resources.
Yeah.
Additionally, we've been doing some work through training to address the intersection of alcohol and sexual violence. What we found when we first started collaborating with MCA-DSV is that our campuses had a lot of resources statewide and on campus to address sexual violence and to think about how they were structuring their Title IX programs, that intervention piece of what we're doing. But they lacked some help in the prevention side and really how to talk about sexual violence, especially with these other issues that they were also addressing, like high-risk drinking and underage drinking and drug use, because we didn't want them to engage in victim blaming, or we wanted them to use a trauma-informed approach so that when they were talking about alcohol and drugs and sexual violence, they were understanding that they were sending a message to students that was supportive and that they were talking about it in their primary prevention efforts and what they were doing.
Yeah. And there are some things that you said that I think are really important to consider and highlight a little more. So really when you were mentioning the subpopulations of students who might be at extremely high risk of experiencing sexual violence, part of what we found in our research is that transgender students with disabilities, face an increased risk, almost the highest risk even, of experiencing sexual violence on campus. And then talking a little more about those consistent trauma-informed ways of talking with students, both before they ever even experience violence, but especially if someone does experience trauma and they need someone to go to. I think being able to really promote collaboration is a strong way of making sure that both folks on campus and off are able to talk with students about trauma, to talk with students in a really important and sincere way about the ways that you can support someone who might have experienced any sort of sexual trauma. And something that we found in our research is that many times campuses and community programs are collaborating in a variety of ways, but because so often folks on campuses are working in silos, they don't always know the extent of those relationships. And then we also found that oftentimes issues of time and resources and then just turf and coverage come into play. And so that's sometimes a barrier. And Sarah, I'm wondering if you can maybe expand on the need to have really important collaborative and strategic ways of working together for sustainability.
Sure. So just a little bit of background. The Department of Health and Senior Services, we receive funding through the Centers for Disease Control and Prevention, through the Rape Prevention Education Grant. That's a part of the Violence Against Women Act. So a lot of different letters and acts and information there. But essentially, we've been able to work since 2014, primarily with college campuses, but also with a few other partners around preventing sexual violence in Missouri. So we have focused primarily on bystander intervention, specifically the Green Dot program, because it is an evidence-based program. And so with such limited resources, we really wanted to focus on programs that we have a strong support that we know are more likely to work. We also, though, have been able to partner with Partners in Prevention and the Coalition to do different statewide trainings to help expand the knowledge base in the state about what is primary prevention, what does it mean to do something that's evidence-based or evidence-informed, and then also for our college campuses to continue to build upon their expertise. So they may be an expert in sexual violence, they may be an expert in alcohol, but how do those issues interplay? And so that's something that we've been really excited to be a part of, are those summits that we've been able to host last couple of years, and how do those issues work together. So it's really been exciting to do this sort of work at looking at campuses as well as the surrounding communities this past year. So that's a little bit about what our department's been up to.
Sarah, something that I think we should expand on a little more is whenever you were talking about the way that prevention efforts in general on campus can really help to complement one another. So really looking at bystander intervention as that violence prevention piece, looking at alcohol and other drug prevention, and making sure that all of those are really consistent across campus. Something that we did in 2017 was go to specific site visits with campuses that are implementing the Green Dot program. And we also invited their community partners, so members of the Domestic and Sexual Violence Organization, and bring them together so that they could really come up with their own ideas of shared collaboration and ideas around that. And then also really start to develop an idea of what relationships exist and how can we bolster those a little more. So I'd like us to go through a couple of those examples and talk about what we might try to tease out of there as maybe some best practices for folks. And so one thing that came up on several of our visits was this idea of having campuses and community programs collaborate on sexual health fairs and then healthy masculinity programming multiple times a year. So I'd like to hear your thoughts on how maybe campuses and communities could partner on those.
So I think one of the key components of this is to develop some shared language, both on campus first and then with the community partners. I think what we find often is that there's enough turf to go around on campus, turf issues, that if we are not focused among ourselves on campus to be able to have a shared focus and vision to have healthy sexuality fairs or to implement primary prevention, when our community partners come in, we're going to look disjointed and it's not going to be a pleasant experience. So I think developing that shared language as a community on campus and then working with the community member to do so, I think is a key component. And what I mean by that is to talk about how we are going to be trauma informed in our approach, looking also at the norms of the college or university. We have some colleges or universities where talking about healthy sexuality needs to be values based because it's a religious institution or there's some sort of guiding principles. But also to be able to work together fully, we need to be on the same page about what some of those expectations are.
Absolutely. I think that's a really important thing to bring up, Joan, in terms of a shared communication plan, shared language. And that's actually another example that came up on our visits, was that a campus and a community-based program wanted to have that shared language and create this communication plan so that if they are at a speaking engagement or they get a media request, or even in working with bringing in additional community partners, that they do have that shared language. So being able to talk about what does trauma-informed look like on campus and in the community? How do we define that? How do we make space early on to really talk about the difference between intervention and providing support services and then primary prevention? And how do we create that shared language between folks?
Yeah, I think all that's so important. I think also too who the messenger is. For example, with a healthy sexuality fair, it may not make sense for one group over another to be the primary messenger for that. If you're the one giving community presentations about alcohol, it might be confusing for you to come in and start talking about another topic to your students. But having really clear communication plans and who's going to deliver what message, I think can be really important, especially with the Green Dot strategy. Green Dot requires a lot of emphasis to be placed on a marketing campaign and who the messenger is and who's involved in that work. And so having a shared communication plan as well as understanding different roles and a shared language is so important.
Absolutely.
I would add too that I think that for some of our campuses, healthy sexuality fairs that have been most successful have included resources about communication and resources about our bodies in general, ourselves as our sexuality beyond just a sexual act. I think that thinking about resources that would come to a healthy sexuality fair would be to expand beyond just having condoms or talking about consent and really helping students understand this more globally for themselves and why it's so important for them to be able to communicate about their bodies and understand their bodies. And it's something they miss sometimes before they come to a college experience.
Yeah. And I think that that's a really nice way of talking about another example that came up on our site visits, just in terms of providing that space to cross-train individuals. And so people do really understand their role to play. So both being that messenger of information and also recognizing that students need to have comprehensive and inclusive messages and information around their bodies, around sex, around sexuality, around health in general. And so really being able to cross-train on those resources on and off campus is a way of being able to also kind of further that shared language in any sort of communication plan.
A lot of our campuses sometimes get into silos where they, especially around peer education or other primary prevention that's done on campus, where there's the peer educators that specifically talk about alcohol and the peer educators that do outreach about sexual violence or sexual health peer educators. And to not have them cross-trained is really doing a disservice, one, to those students who are providing that information, but to the students that they're training. And thinking about what that shared information is true for all of them, doing some sort of joint peer educator training or messaging training, I think is key, whether it be event planning or peer education outreach, or and I think also not beyond peer education, it's working with like our law enforcement or our conduct professionals, our Title IX professionals. While they might be more focused on the intervention side, I think they still need to understand why prevention is so important to what they do. I think that's just really, really important to allow us to work beyond the silos that we sometimes find ourselves in professionally.
I think that that's also a really good way of, once again, kind of having a transition into one of the last examples that came up out of our site visits, which is creating a prevention advisory committee. And so being able to pull all of these people together for a consistent time where you can meet, you can talk about these things, you can look at different data sets in terms of both student population, in terms of prevalence rates that police might be getting, in terms of prevalence rates that the community-based program might be getting, and using all of that data to really inform your prevention messages. And I completely agree, Joan, that I think it's really important that we consider how everyone has a role to play, so that way we don't feel too overwhelmed when we're doing this work. And Sarah, I know that you've talked a lot with programs about that, not having to take on all the responsibility.
Yes, so our programs that have been implementing the longest, one of their biggest takeaways and their advice that they always give other programs is you can't do this work alone. You have to have a team for lots of different reasons. One, you need different messengers that will relate to your students. Two, for sustainability. If someone is going to be out of the office, say for parental leave, or finds another opportunity on a different part of campus and can't commit to as much time, or whatever that turnover may look like, you need someone that's always trained and available and ready to do this sort of work. So, and that extends outside of the campus. So in your community too, that if there is turnover within an organization, that you still know that that's your partner, that you work together. And then so when someone new comes in, they know that that's a person they need to meet with right away, that it's a relationship to continue to build upon, and for it to not just disappear because someone leaves an organization. So I think that that's sustainability and building that team that can meet regularly, and that everyone knows that that's the expectation. So even if one person leaves, that it's still a part of that campus, and it's a norm on that campus, that this is something that's important to us, to have those relationships, and that this is a topic we talk about.
Yeah, as if there were a reason to have a team approach. I think we've just given plenty of examples, right? Exactly. That really whenever we do this work, we are stronger whenever we're able to work together and really bolster all of our efforts.
I think you can look at the partnership between all three of our organizations or agencies and use that as an example of what can happen also in the community and on campus. And recognizing that when Matthew and I first started collaborating on behalf of our organizations, we knew that we had access to the campuses and we knew how to reach the campuses, but our sexual violence prevention that we were doing, we needed that level of expertise that MCA-DSV was able to provide, and that partnership was really rich. And I think when our campuses learn that this is a shared responsibility, that we're never going to get anywhere without working together, but also that we can take from each other's, kind of make a collective action out of each other's own experiences, I think we're better.
Exactly.
Yeah, I agree.
I know one thing, and it's cheesy, but in Green Dot we always say no one has to do everything, but everyone has to do something. And so I think in having these relationships, it really is true that we don't have to do everything, but together we can all do something, and that partnership is what really going to make that difference.
Yep. All right, well, thank you, Joan and Sarah, for coming by today. I really valued y'all being able to come by and our conversation about the importance of being able to collaborate between campuses and then community-based programs, and just the insight that y'all were able to provide.
Thank you. Thank you.
For more information on resources for how partnerships between campuses and their community-based programs can be more meaningful and sustainable, please visit the campus section of our website to view additional publications and resources.